Hello, everyone. This is Dr. Marty Ross, and we're here for another Conversations with Marty Ross MD tonight. This is my Lyme Q&A, where we talk about all things Lyme disease and mold toxicity and chronic fatigue and fibromyalgia and sometimes even long COVID. I look forward to seeing what you have in store for me tonight. No 2 weeks of this are ever the same because you create each webinar with your questions. For those of you that are new here, there's a couple ways you can participate, and even those returning, but for the new people, I just want you to know how you participate. Number one, you can write a question to me, and you do that in the chat box down at the bottom. I think it's on the right-hand side of the screen. The only thing I ask about your questions, keep it shorter. If these get to be really long questions, that doesn't work out for this format, okay? And then the other way to participate is to see what questions others have and see what kind of response I have to those. There's a lot of good learning that can take place, even if it's not your question that I deal with right away. Okay, all right. I am creating a recording of tonight's webinar, and that recording should be out to, if everything goes as planned, somewhere around 9:30 to 10 a.m. Pacific Standard Time, Seattle time. So I'm in Seattle, Washington, everyone. So look for that. And in there will be a summary of what we talked about today as well, too. Okay. And then let me see, what else do we have here? During the webinar, I will post the questions in the live version. You'll be able to see the questions actually on your screen. I post them so you can see them and read along as I write them. Sometimes that makes it a little bit easier for people to follow along. So you'll have that opportunity. If you're in the recorded version, though, they don't show up in the recorded version, unfortunately. And so you'll have to pay attention to what I say as I'm reading the question. All right. And so without any further ado, let's go ahead and get started here. Hello, Joan. Let's see. Dear Dr. Ross, I am in my 5th month of taking cholestyramine and itraconazole for mycotoxins. I had no success with herbal binders after 7 months of treatment and for a couple of years before that. Last week, I was diagnosed with osteoporosis, was osteopenic for years. I'm 66 years old. My T-score went from negative 2.4 in 2023 to negative 2.9. 2.9. I was found to have a crack on my sacrum on MRI due to lower back pain, which is resolved but no other symptoms. I have been prescribed biophosphonates. I have been taking bone builder with boron by Metagenics, magnesium, jigsaw, SRT, vitamin D, and K2 daily for years. My vitamin D levels were always within optimal range, but the latest level is 45 nanogram per ml, which I believe is suboptimal. Anyway, I read that cholestyramine can contribute to osteoporosis, so I stopped taking it last week. I'm also concerned if I was absorbing the itraconazole. It was making my supplement meds. I was taking my supplement meds as recommended 2.5 hours after taking the cholestyramine. Let me see here. Joan, I gotta see if there's a second part to your question. Well, I see you attempted writing it twice and everything got cut off here. So Joan, I don't know what your question was going to be because unfortunately it's just, you wrote a very long question, which this format is not set up to handle, but I'm gonna make a couple comments for you. So cholestyramine can potentially bind good minerals like calcium. So I understand why, if you have osteoporosis, that you might consider stopping it, okay? However, you should be able to take enough calcium in your diet to overcome the blocking effect of cholestyramine. Secondly, the world around hormone replacement therapy, and even though you're 66, I want to have a conversation with you about this. So estrogen that you would get if you were doing hormone replacement therapy is one of the biggest promoters of bone health and is very effective at helping to promote bone density and resolution on the osteoporosis that you're having. Now, the world of how we handle hormone replacement therapy has changed. And part of the problem is about 20 years ago, there was an NIH study that was very poorly designed that showed that the authors reached a conclusion that women taking estrogen and progesterone were at a higher risk of having breast cancer. And so therefore, the study was halted and we no longer gave hormone replacement therapy to women. It was a great injustice, to be quite honest with you. We now know that there were some problems in that design of that study. Number one, they were using something called Premarin, which is pregnant or estrogen from the pregnant mares, which is not the same as the estrogen that women have. And they were using a synthetic version of progesterone. In re-looking at those studies about safety of hormone replacement therapy, it now appears that the problem that was leading to increased breast cancer was actually the progesterone that was used, okay? Subsequently, we now know for sure in women that start the right kind of estrogen and the right kind of progesterone before age 60 or within the first 10 years of menopause, that being on estrogen and progesterone will help improve bone health, will help improve, decrease your risk of developing dementia as you get older, and will also be useful at promoting cardiovascular health too. And there does not appear to be any increased risk using the right kind of estrogen, the right kind of progesterone in breast cancer or other problems, okay? So the right kind of estrogen is something called estradiol, and the right kind of progesterone is called micronized progesterone, and also known as prometrium, okay? Now, in women that are over the age of 60, while the benefits may not be as great as starting this as when you first start entering menopause at preventing heart disease, preventing dementia, and promoting bone health, there still is benefit that some of the more recent studies seem to suggest. And so in a situation like this, I might consider also looking at using estrogen. And if you still have a uterus, to prevent developing uterus cancer, actually you would want to be on prometrium or micronized progesterone. Now, because this is a newer way of looking at this, and because it is just within the last month or two that the Food and Drug Administration removed its black box warnings about safety of estrogen from estrogen products, many doctors are not familiar with this, and many primary care doctors are not prescribing hormone replacement therapy. But usually you can find somebody that, especially the functional medicine doctors, that would be willing to do that. So that might be something you want to consider doing as well too. Okay? All right. Good luck to you, Joan. Hello, Joe. Let's see. Hi, Dr. Marty Ross. Thank you for all you do for the Lyme community. You're welcome. What are your thoughts on taking sweet anti tincture daily for Babesia? I know you prefer to pulse artemisinin in capsules. Also, what are your thoughts on SOT for Lyme, Bart Babs? With Lyme not living in the blood, would it still be effective for Borrelia specifically? All right. So I haven't used sweet anti tincture for Babesia, and I'm not. It is not on my radar screen, so I can't comment about its effectiveness. The herbs that I prefer to use for Babesia is cryptolepis, actually, which is probably the strongest herbal antibiotic we have. And I tend to like to dose it. I use a 5-to-1 tincture, which means it is a tincture that is developed or created by taking 5 parts alcohol and 1 part cryptolepis plant, and it's in that 5-to-1 ratio that the extraction of active chemicals from the cryptolepis are completed, and that's how you get what's in the solution. Okay, all right. And the dose that I like using for Babesia is a pretty hefty dose, actually, but I find it to be effective. I like to dose it at a teaspoonful which is 5 milliliters, 3 times a day. You can also combine that with artemisinin. And the way I like using artemisinin is to do pulsing on the artemisinin. The reason I pulse the artemisinin is that your liver develops enzymes or creates enzymes when it's exposed to artemisinin that will work to deactivate it. So you want to use it at a high dose for a few days and then stop it while the liver gets rid of those enzymes that deactivate it, okay? So my recommended way of using artemisinin is to use a 100 milligram capsule. The product I like for this is a product made by Allergy Research Group, and it's 100 milligrams, and you would want to do 200 milligrams. Start by using 200 milligrams 3 times a day for 3 days in a row, take 11 days off. If that first round does not clobber you, if you don't get a big Babesia herx, and a Babesia herx would look like increased fatigue or more air hunger, those are 2 things that will sometimes show up, and they can show up out to the 5th day. So even though I'm going to suggest you take it for 3 days, on day 5 is when the fatigue and the increased air hunger could begin, okay? But if you tolerate it fairly well, then the next round, you want to go up to 300 milligrams 3 times a day, 3 days on, 11 days off. And as you can, you want to work up to 400 milligrams 3 times a day, 3 days on, 11 days off, and eventually up to 500 milligrams 3 times a day, 3 days on, 11 days off, and then just keep that cycle going, okay? If you combine that with cryptolepis, you have probably what I would consider to be the strongest herbal option to manage Babesia, okay? All right. And then in terms of SOT, I'm not a fan. I'm just not a fan. So SOT basically, let me see how I can explain this. So SOT stands for supportive oligonucleotide therapy, okay? I have a whole article on this. I will be glad to show it to you. But essentially what it does is it uses, so the building blocks of your DNA and your RNA, the genetic material in you, is something called nucleic acids. And what happens inside your cells is your DNA RNA will attach to DNA, and then the RNA so the DNA is the blueprint. RNA attaches and copies that blueprint and is moved out of the center of your cell out into the cytoplasm or the outside of the center of the cell area, and it goes into what are called protein production factories called ribosomes. And the RNA nucleotides then are translated into making peptides, okay, or proteins and peptides, all right? Now, the way that SOT works is we develop an RNA strand that will attach itself to the RNA in your ribosomes and keep them from being translated, okay? So it effectively blocks protein production. And how this works then specifically for tick-borne infections is, in theory, RGC, which is the company that develops this and then ships it into the US, in theory is supposed to find your Bartonella or your Borrelia or your Babesia in your blood, and then figure out what genetic sequences that germ produces, and then develop a blocking RNA strand that then gets shipped to the US and gets injected into you, and somehow miraculously is supposed to wind up in your cell and not get destroyed and attach to the ribosomes that are producing proteins for these germs and basically block them from producing. Okay, that's how it's supposed to work, all right? Now, here's the problem. RGC has never done any studies to prove that the strands that they send for your germs actually have any chance of getting absorbed into your cells, because your plasma, where this stuff gets injected, is full of enzymes that are there to destroy strands of RNA that are running around there, okay? So we don't even know if this stuff gets in you. Secondly, I'm not sure what they're sending, because the ability, so what they're doing to figure out what's in you is they're doing PCR testing or genetic testing to see if the germs are in you. We know with Borrelia that PCR testing, looking for the genetic material, will only find Borrelia Lyme if it's in you 30% of the time. So if you send a sample off to them and they say, well, you don't have any, it doesn't mean that their treatment has worked. It doesn't mean you don't have any. It just may mean a sampling error, you didn't get it. We also know that doing DNA, RNA testing for Bartonella and Babesia may be problematic as well too, all right? So on the whole, I don't know that this treatment works. I know that there are people that pay their $5,000 to get this done, and there is no experimental database that suggests it works. There is a hope it might work, but do you want to pay $5,000 for a hope that something will work? I don't know. I wouldn't do it. I do admit there are people that claim some benefit, but keep in mind, anything we give you, whether it's prescription medicine or herbal medicine, vitamins, has a 35 to 40% chance of helping you based on a placebo effect. Meaning not because it does anything active, but because taking it creates some environment where you feel better. Okay, so as an example of that, when a drug is researched, try to see if if the FDA will approve it. The companies that do the research have to do a trial called a double-blind randomized controlled study. Okay, and in that type of study, somebody gets the active drug and somebody gets a placebo. And the researchers collecting information don't know who got what during the study. And the people that are in the study don't know whether they get the active drug or a placebo. All right. So there's no biases that can interfere with how the data is interpreted. When you look at those studies, people that are in the placebo group across the board in drug research, about 35 to 45% of them will report similar improvements to the people that got the real drug. Okay, that's a placebo effect. They didn't get an active ingredient, but the act of taking a pill creates some kind of a healing environment in the body that has nothing to do with the active substance. All right, so I admit maybe 35, or I don't know, but I admit that it's possible that some people feel better after they pay $5,000 to feel better. Maybe it's because they paid $5,000. I don't know. So it's not a type of therapy that I endorse, okay? So let me go ahead and show you the article, which gives you much more detail about this and the interactions I had with RGC, trying to get some adequate data about how good their testing is and about whether they have any proof that this stuff works instead of just wishing it works, like I think most SOT practitioners are doing at this point. So let me go ahead and do a screen share here. Oops, hold on a minute. I didn't get I have to set my computer up differently. Hold on here a minute. Let's see. All right, let's try that again. There we go. Okay, so this is my Lyme information site, Treat Lyme by Marty Ross MD. And there is an article I wrote on SOT. So if you want to find it, you can just type in SOT. And my title is SOT for Lyme tick-borne infections a scam? And I think you know my answer to that. But it describes it in more detail about how this whole thing works and why I have problems endorsing this type of therapy. Okay? All right. All right. Good luck to you, Joe. Oh, one other thing I'll just show you. I know I mentioned getting a 5-to-1 tincture of Cryptolepis, and I just want to show you how you'd go about doing that. So in my store, if you look under the tab called Montana Pharmacy, the products I recommend for herbal antibiotics are all here. And the crypto product that I would recommend is this one right here. All right. And so I no longer sell products directly myself, but I have a trusted partner called Phimologist, and you can even see that on the Buy Now button, buy at Marty Ross MD Phimologist store. So I partner with a store called Phimologist, and you would go over and buy it directly from a Phimologist, okay? And if you go there through these buttons, there's a discount that you'll get for purchasing from them as well too, all right? All right, let me go back here. Hello, Priscilla. See, thank you, Dr. Ross, for your ongoing support with understanding tick-borne diseases. You're welcome, including Swassen virus, which seems to be chronic now for me. I have a quick question. My GI doc wants me to eliminate plant-based foods and supplements for 1 week preceding scoping for celiac disease. The supplements are all in veggie caps. Are the veggie caps a problematic source of plant-based material? If so, can I take ALA, NAC, ATP, etc., without the veggie caps, putting the contents in plain yogurt or something similar? Thank you. You know, it's interesting. I'm not sure. So, I'm not sure why your your provider is doing that. So the issue with celiac disease is you're wanting to see he's gonna be scoping you, and he's gonna want to see on biopsy, do you have lesions in the intestinal tract that we see when you have celiac? And the problem is in celiac is that people with celiac cannot eat wheat. If they eat wheat, it's going to lead to a lot of inflammatory changes in the intestine lining that would be seen on biopsy. So usually when you're testing for celiac disease, you want to make sure that people don't limit wheat. You want them taking wheat and gluten because you want to see if they have inflammation, okay? Now, if your doctor is doing this because you've already eliminated wheat, then they want to make sure that to see, are you having improvements by eliminating wheat? And in that case, you would want to avoid anything that cross-reacts with wheat, including oats, barley, and I believe rye would be grains that might cross-react with it. Maybe your GI doctor is going one step further to say, I just don't trust supplements of not having gluten or gluten-like grains in them. Therefore, I want you to stop everything. That may be what's going on. But if they're really just trying to test to make sure you have celiac, I'm not sure why they're limiting you on anything, okay? That would be my comment. I think if your provider has told you not to be on supplements, plant-based foods, that would be any supplement. I would just get off of them and go back on them once you're done with the colonoscopy. Okay, all right. Or scoping, I should say. They're probably going to be doing endoscopy from above. Okay, all right. Good luck. Let's see. I'm not sure if I did this one already or not. Okay, no, that's a new question. Okay. Hi, Dr. Marty. Thank you for continuing to do these webinars. I find them helpful as even when the question doesn't pertain to me directly, I always learn something. Thank you. Thanks, Joyce. Let's see. I always learn something. I was diagnosed with Lyme in 2001 with 4 weeks of doxy. In 2016, after 15 years of baffling symptoms, I was diagnosed with active Lyme, Bartonella, and Babesia. My Lyme practitioner in Connecticut has passed away, and I now live in North Carolina and have been following you since 2018. Now experiencing late-stage Lyme with stringy, tight, and painful muscles, all of which restrict what I'm able to do despite continuing to work out. Secondary issues are random arthritic pains in hands, feet, and shoulders. Besides creatinine, which blood test should I focus on? I'm researching Lyme specialists in North Carolina, and I'm considering the one I am considering uses Galaxy, Igenix, and Infectolabs, among others. Your thoughts? Trying to find a doctor who is well educated in Lyme world and who would actually cares about the patient is exhausting and expensive. I have been to many over the years. All right, let me just see. Joyce, there seemed to be a second part there. Let me see if I can find it here. Nope, not finding. Okay, so as part of testing, to see, you're going to need a doctor that's experienced trying to look at the clinical picture as well as test to figure out what might be active in you at this point, okay? If you have tested positive for, how can I say this? So when it comes to testing, there is what is known as direct and indirect testing. Indirect testing is looking to see, is there an immune reaction that can suggest the germ is in you? Direct testing is, can we actually quantify it or see it under the microscope or in the lab, okay? Galaxy does PCR testing, genetic testing for Bartonella, and that could give you a way to look and see if there is actually Bartonella in you at this time. Igenix, and Galaxy actually has some antibody testing. Igenix does an immunoblot method called, that looks for antibodies, called immunoblot, okay? They also have FISH testing, which is microscope testing for Babesia and Bartonella. So Igenix would offer both direct and indirect. Direct means you can see it under the microscope or you can quantify it. Indirect means you're just looking for an immune reaction, okay? Infectolabs looks at whether, does a test called an ELISpot. And the ELISpot is an indirect test, but with it, we kind of get a sense of whether the germ might be in you right now. And so the way that an ELISpot works is we take T white blood cells that fight infections from your blood, and we expose them to proteins from the germ we're trying to test for. And then we measure whether they release cytokines from, and the only way they'll make cytokines is if they have tried to attack that germ before. Now, here's the thing about T cells. They're looking at what are called circulating T cells. And circulating T cells only live for 2 months. So presumably, with an Infectolab ELISpot test, if it comes back positive, it would suggest that the infections are still alive and in you, okay? The limitations on the ELISpot or the Infectolab ELISpot test is they only do tests for one strain of Bartonella rather than all 15 that you might get. For Babesia, they only test you, I believe, for 2 strains of Babesia, and we think there may be around 11 or 12 strains of Babesia. And for Borrelia, they're only testing you for the US Borrelia burgdorferi, but we now know out on the East Coast, we're now starting to see more of the European strains coming over called Borrelia guerini and Borrelia afzeli, okay? So even though Infectolab, if it comes back positive, may give you a clue that they're in you right now and active, the trouble is they miss a lot of stuff, all right? The Igenix test, I think the most sensitive test to see if your body has ever tried to attack an infection is the Igenix immunoblot method, which is looking at antibodies. But keep in mind, if they find antibodies, it doesn't prove the infection is in you right now. It just says your immune system has reacted against the germ. So in a way, you could kind of look at the Igenix test. If it comes back positive, it tells you what you've been exposed to over time, but it does not prove that the infection is still in you. I like using that test, though, because by looking at it, I can tell of Babesia, Bartonella, and Borrelia, which of those have you had at some point in the time? And then I talk to my patients about their symptoms and I use the symptoms to guide me as to what might be active, okay? So what I'm suggesting is you need to work with a provider that understands the ins and outs of working with these labs, but absolutely find one that knows how to work with an IGeneX, an Infecto lab, and a Galaxy, and is also good at looking at your symptoms and using your symptoms as a guide to what might be there as well too, all right? What I would not do is go to a provider that is using Vibrant labs, because Vibrant has not validated that their labs are accurate. And then we tend to get a lot of false positive Babesia and Bartonella testing out of Vibrant. So if you told me you were going to somebody who's using Vibrant labs, I would tell you to think again. Likewise, DNA Connections, which is another one of the lab systems out there, has not, looks for genetic material of the germs in your urine, has not validated its studies enough to know are they accurate. And I think we get a lot of false positives there too. Okay, all right. Other labs that you might want to do just as a baseline, get something called a CMP, which is kidney liver testing. That's comprehensive metabolic profile, also called CMP. Get a CBC to look at your blood counts and what your white blood cells are doing. I would consider getting thyroid testing done with this kind of a picture by looking at TSH, free T4, free T3, and something called reverse T3. All right, let me explain that real quick. So your thyroid gland sits here in the neck, and it makes thyroid hormones. It makes T4 thyroid hormone, T3 thyroid hormone, okay? The big difference between T4 and T3, there's a couple. One is T4 has 4 pieces of iodine on it, and T3 has 3 pieces of iodine on it, all right? But the big difference is which one is active out in your tissues. So T3 is what drives all the chemical reactions inside your cells and gives you energy. Your thyroid gland, however, makes 90% T4 and about 10% T3. And out in the tissues, all of that T4 has to be converted to T3. There are some people when they have chronic illness that T4 doesn't get converted into T3, but rather it gets parked as something called reverse T3. It's kind of like, it's a way of putting the body into hibernation in a sense. So sometimes when people are really sick, your body may want to try to make you sleepy to get you to hibernate, if you will, so that you can recover. And one way of doing that is parking your T4 as reverse T3 rather than letting it become T3, okay? So you want to test for that one as well too, all right? So those are some thoughts for you, okay? I could see, I might consider doing an Infecto lab and maybe IGeneX testing with you if I was trying to help determine what's active in you right now, okay? All right, good luck to you, Joyce. What I might consider doing, let me rephrase that. I might consider doing the immunoblot methods from IGeneX because it would at least let me know based on the response as to whether what germs have been in you in the past and might still be in you, whether it's Babesia, Bartonella, or Borrelia. The immunoblots are 94% effective at identifying what is in you or has been in you, okay? That's called sensitivity, all right? And then I might get some clarification as to whether they might still be active by ordering an Infecto lab ELISpot test too, okay? All right, good luck to you, Joyce. All right, let's see here. Hello, Rachel. Let's see. I have recently had real-time mycotoxin panel, and gliotoxin is very high. I'm on cholestyramine, but didn't know if I should be on any other binders as well, specifically for this type of mold. Thanks. So a couple of things to think about here. So gliotoxin is a toxin that can be produced by mold in your environment, but it can also be produced by too many yeast living in your intestines. All right. So if you, on your real time, the only thing that was elevated is gliotoxin, I might start also considering whether this is not coming from a wet building, because a wet building often will produce more than just gliotoxin. It might produce ochratoxin, it might produce aflatoxin, it might produce zearalenone, I mean, all kinds of things, okay? But if you're just getting the gliotoxin, you got to ask, I wonder if that's not from a wet building. I wonder if it could be something else. And so, and even if it's part of, especially, if you get a real-time lab and you have multiple elevations, including gliotoxin, you still have to question. I always wonder, is this from too many yeast in the intestines? All right. So there's a couple ways to figure out if you might have too many yeast. One is if you have never been treated for yeast before, you could use a screening questionnaire I have. I'll show it to you here in a minute. And if you score over 140 on my screening questionnaire, there's a good probability you have too many yeast. Now, that questionnaire is looking at what are your risk factors for getting too many yeast. And so have you had a lot of antibiotics? Have you had steroids? Were you on birth control pills before, et cetera? All right. And then it also looks at your symptoms and how intense they are related to symptoms we might see with intestinal yeast. And then you score it up. The thing is, though, it's not as accurate if you have been treated for intestinal yeast overgrowth before, because in that case, the historic factors that led to you possibly getting yeast have been addressed one time, right? So it's mainly useful if you have not had intestinal yeast overgrowth treated for a prolonged period of time in the past, all right? So if you have had intestinal yeast treated in the past, then you still need to consider, could you have intestinal yeast? And so in that situation, the questions I look at are, number one, do you have a lot of sugar cravings? Number two, if you have sugar, do you feel worse for it? And if you do, that can be a suggestion of too many yeast in the intestines. Number three, do you have a lot of gassiness and bloating? Number four, if you're a female, do you get repeated vaginal yeast infections? Number five, do you have skin conditions that get worse? So are you suddenly getting eczema and you never had it before? Do you have psoriasis that is worse? And the other one would be, do you get a lot of pimples or acne? All of those can happen when you have too many yeast living in the intestines, okay? All right. So I would consider, do you happen to have gliotoxin from yeast, okay? All right. Secondly, gliotoxin tends to be bound best by bentonite clay, all right? So you might consider using bentonite clay as a means of covering for that, all right? So let me just do a screen share. I'm going to show you a couple things here. Okay, so for bentonite clay, that's interesting. All right. So the bentonite clay product that I recommend is called MediClay. And the reason I recommend this product is it is free of contaminated heavy metals, basically, okay? And you could do 1 or 2 pills one time a day, all right? And that would be a way of trying to bind up the gliotoxin that's in you, okay? And then in terms of resources that I have about yeast, take a look in my limology guides here. Look at this yeast section here. And then to help you determine, do you have too many yeast, click on this, a silent problem. Is it yeast? And down here, I go through, if you've ever treated it before, I tell you the symptoms to look at. And I just went through those, okay? But if you have never treated it before, then you would use my yeast screening questionnaire. And again, if you go through this and you score more than 140, is highly suggestive of having too many intestinal yeast. Okay. All right, let me go back here. All right. Good luck to you, Rachel. Hello, Catherine. Let's see. I've had Lyme for 10 years. I am experiencing tingling where the tick bit me and also tingling on the right side back of my neck. The tick bite was on the right thigh. What do you suggest? So I don't have a specific recommendation. What I would want to know a little bit more, and obviously because I can't ask you directly, I would want to know what else is going on in your world besides just having tingling in the back of the neck. In other words, how is your health overall? Because I would be wanting to know, is it possible you develop some mast cell activation, which could be giving you that tingling? Do you have mast cell activation syndrome? Do you have active tick-borne infections? And I would need a lot more information from you about your symptoms to help figure that one out. Okay? All right. Good luck to you, Catherine. So, Catherine, if you are wanting some more, I'd be glad to give you more direct help. Again, it may not even be in this forum, but for those of you that are hoping to get some more direct input from me than you can get in this type of a forum, I just want to show you how you would do that. So this is my practice website, martyrossmd.com, and I offer a couple different type of appointment options. One of the appointment options that I offer is an educational medical consult where we visit online. It doesn't matter where you live in the world. I can give you my opinion and make recommendations about things you might want to try, including prescriptions, herbal supplements, and even testing that you might want to do. The hitch is, though, because this is an educational visit, I do not prescribe, I don't order the test, and I can't use ICD-9 diagnosis codes, all right? This is, and the reason that I offer this type of visit is I can only do full medical practice where I prescribe, do formal diagnosis, and order tests if I'm licensed in the jurisdiction where you sit when we talk. So in other words, if you're in New York State, for me to be your prescriber, diagnoser, and test orderer, I have to be licensed out in New York State. And at this time, I'm not, although I do have an application pending. We'll see what happens with that. So if I am not licensed where you are, then this is the way you can visit with me, okay? All right. If you want to come see me for every visit and you don't live in Washington State where I'm licensed, you could do a full medical service. Also, if you are a Washington State resident, after you see me one time for a full medical service, I will visit with you doing telemedicine as long as you have your feet in Washington State when we visit. Okay? All right. So those are the two ways to see me. I do have a number of people coming to see me from across the country that fly out to get their full medical service. Okay. So that is an option for people to do. That's a way to get care from me as well too. Okay. All right. And I welcome new patients. I still have room to see people. So yeah. All right. Let me go on here. Let's see. All right. I think I may have answered that already. I'm going to pull that down. All right. Oh, okay. This is a two-part question. All right. Let me go back here again. So Cami says, I have Lyme, Bartonella, Babesia, mold illness, and also have SIBO, Candida, and Klebsiella gut infections. Should I start treating the gut infections first, or should I break open biofilms and start treating the biofilms, Lyme, and gut infections? What is the best biofilm buster to use? Okay. So in a situation like this, where there is SIBO, which stands for small intestine bacterial overgrowth, it's a condition where you have too many bacteria living in your small intestines that aren't supposed to be there. We're not supposed to have much living within the small intestines. And if you get bacteria living within the small intestines in excessive amounts, they will wind up fermenting the food you eat and give you a lot of gasiness and bloating, which is uncomfortable. But the bigger problem is they trigger a lot of body-wide inflammation then too. All right. So they become a source of excess cytokine inflammation, the similar kind of cytokine inflammation you get when you have tick-borne infections that makes you feel terrible, as well as mold toxicity that makes you feel terrible, as well as the cytokine excess you see in too many yeast living in you that makes you feel terrible. Okay. So it can add to the cytokine mess you have from tick-borne illnesses. Generally, what my approach is when somebody's got SIBO and or they have large intestine dysbiosis, meaning imbalance. In your case, Klebsiella should not be showing up there. That's dysbiosis. I try to deal with the SIBO and the dysbiosis first, because you're going to have a lot of sensitivity problems taking things until we get those under control. So that's usually what I'll deal with first. Okay. All right. Good luck to you. One thing you could take, just so you know, and I would work with your healthcare provider on this too, but one way to go at the Klebsiella, as well as which is in the large intestines, and the SIBO, which is small intestines, is to work with an herbal antibiotic preparation. And the one that I like to use for this kind of a situation that supports rebalancing of bacteria in your small intestines and getting that Klebsiella under control within your large intestines would be, and it's a sport herbal medicine. It would be it's by biobotanical researchers. It's by, well, what do they call themselves now? Biocidin Botanicals is the name of the company, and the product is called Biocidin. And you want to do either their Biocidin capsules or their Biocidin liquid tincture. You would not want to use the Biocidin liposomal formula, which is also called Biocidin LSF. The reason you don't want to use the Biocidin LSF is because it's a liposomal formula. That product is made to get the 10 herbal ingredients in there absorbed into your bloodstream so it can go after Lyme and biofilms and tick-borne infections there, but it doesn't leave enough behind in your intestines, okay? So you could look at working up to Biocidin capsules, 2 capsules 3 times a day, or you can work up to 1 to 2 dropperfuls 3 times a day of the Biocidin drops, okay? All right. So Biocidin has some Oregon grape. It's got, I believe, oregano in it. It's got some garlic in it. It's got a number of other herbal antibiotics in it as well too. And if you use it over a 2 to 3 month period, there is some research that suggests that herbal antimicrobial preparations do better in a lot of varieties of SIBO than prescription medicines do, especially if you have a type of SIBO where your bacteria in your small intestines are predominantly producing methane. If you're a methane producer, one of the better ways to go is to do the herbal antibiotic preparations, okay? All right. So let me just show you how you would go about going after SIBO. I'm going to show you an article I've written. All right, it's this article here called SIBO and Lyme Disease, okay? And you would want to take a look down here. We talk about limiting certain foods that feed all that fermentation. So you want to get on a FODMAP diet for a bit. And then you want to basically work with a microbe and biofilm support blend. That's what I call it here. But what I use is the product is called, is the one I was just telling you, okay? And that Biocidin has bilberry, grapeseed extract, shiitake, golden seal, noni fruit, garlic bulb, white willow bark, milk thistle, raspberry, echinacea, tuberose echinacea, black walnut hull, and then some lavender oil, oregano oil, tea tree, galbanum oil, and gentian lutea root. Okay, those are all things that can be effective at rebalancing bacteria in the small intestines, as well as in the large intestines as well too. All right, and so the product that you're looking for then, that I suggest in situations like this, is called Biocidin, and you want to do either the liquid or you want to get the capsules, which is this product here. Okay. All right, there you go. And again, you can find this by clicking this button. You can see it over at the Phimologist store, my trusted partner in supplement sales. Okay, all right. Thanks for the question, Cami, and good luck to you. Hello, John. Let's see. Thanks again for all you do, Dr. Ross. You're welcome. Let's see. While I treat for Lyme and Bartonella, is there any recommendation you have for anhedonia? I know that it will improve as I get the bugs out, but is there any way to help that particular symptom while treating the underlying infection? One would hope. So the Bartonella is more than Lyme, seems to be involved in psychiatric symptoms. And those psychiatric symptoms, including the anhedonia that you have, are going to be due to inflammation within the brain. Okay. So yes, you need to work on killing Lyme and Bartonella. That's part one. Number two, we want to work with anti-inflammatories that will target the microglia in the brain, which are your white blood cells in the brain, and get them to stop making as many cytokines that then flood the nervous system and lead to some of these psych issues. So one thing you would want to do is be on the curcumin that many of you know I talk about for lowering cytokines, but you want to do it in this situation too, because it will help lower the cytokines in the brain, potentially lower the cytokines in the brain. Because it's an herb, I can't make a drug claim on it, but it should support lowering cytokines in the brain and give you benefit. And I've seen some benefit that occur from that. Okay. And so I would do the product I like is a product made by Thorne, which is called curcumin phytosome. It is a liposomal variety of curcumin. Curcumin is a component of the seasoning turmeric and does a good job of getting inside white blood cells and limiting cytokine production. Okay, all right. And I usually suggest that people take a 500 milligram pill, one pill 3 times a day, again, of that Thorne curcumin phytosome product. Okay. The other thing you might want to consider is herbally, rather than taking psychiatric prescription medicines, sometimes raising serotonin in your brain can help with this. And one of the ways to do that naturally would be to take 5-hydroxytryptophan. Tryptophan is a building block for serotonin. And if you take 100 milligrams 3 times a day, that may be enough to help build some serotonin levels in your brain by making more of it, which may help lift your mood as well too. Okay. Yeah, those would be my general thoughts on that. Okay. All right. The other thing, no, I think that's what I would suggest. Okay, very good. Good luck to you, John. Hello, Rick. Let's see. Greetings, Dr. Ross. I was diagnosed with Babesia. Hold on here a minute. Bear with me just a second here. Oops, I forgot to bring water in. Hold on just a minute, everyone. I got to get a drink of water here. I'll be right back. right. Coming back here. Sorry about that. But I just feeling a little bit parched there all of a sudden. All right, Rick, let's see. I was diagnosed, greetings, Dr. Ross. I was diagnosed with Babesia via the Igenix fish. My provider had me on Malarone, which is atovaquone and proquenil, 2 times a day, but saw no improvements. I've been on herbals for over a year now, including cryptolepis at your recommended high doses, your typical 3B stack, liposomal artemisinin, and several antibiotics. My provider put me on tafenoquine, 300 milligram 1 time a week, and did the loading dose. After 3 months of tafenoquine, I have not improved. My provider wants to stop tafenoquine and just do liposomal artemisinin, pulsed 3 days on, 11 off. When I asked why, she stated that's how she was trained. When I asked why, she stated that's how she was trained and that's what the protocol calls for. But my understanding is tafenoquine requires longer than 5 months. Can you please clarify? She also had me stop the Malarone after starting tafenoquine, which, as I understand it, can lower success rate. Can you please comment on this? Thank you. All right. So let me make just a couple of comments. And I'm going to go in a couple of different directions. I'll put it that way. So first of all, if you are on, Babesia replicates about every 24 hours, and which is different than Borrelia, which can take weeks to replicate. So things that replicate more quickly, if you're killing it and the treatment is working, you'll tend to get a quicker response than things that replicate more slowly. And what that means is when you're looking at when somebody's not getting better, generally, your Babesia treatment that you are on or Babesia supports that you are on should be making a difference by about 2 to 3 months that you are killing them. And if not, it means that that regimen may not be working. All right. I didn't say you would be all the way better, but it should be making a difference. So symptoms I like to follow that give me some clue as to whether my Babesia treatments are working for my patients is I'd like to look and see. I always ask them at the beginning, do you have night sweats? Do you have air hunger? Which is a feeling you can't get enough air from time to time. Do you have frontal headaches? Do you have migraines? Do you have racing or skipping of the heart? Do you get lightheaded easily on standing up? Or do you have a lot of deja vu experiences? Yep, deja vu. Deja vu seems to be a symptom that occurs in some people with Babesia, not everyone, right? And so if they answer yes to those and to some of those, and I think I said panic attacks, so night sweats and panic attacks too, okay? So I follow those. So if they said, yeah, I sweat a lot at night and I get panic attacks and I have frontal headaches at the beginning of treatment, then I'm going to start asking them at each visit, are those getting any better? And I want to see by 2 to 3 months that we're starting to see some improvements in those, okay? If not, then it's time to go back and relook at what you have a person on and make some changes to get a more effective killing, okay? Number 2, we like to treat for Babesia a minimum of 5 months. And the reason that we like to do that is Babesia lives in your red blood cells. Your red blood cells have a life cycle of about 3 to 4 months. So once they're made in the bone marrow and they get released into the bloodstream, they will live for about 3 to 4 months, okay? For whatever reason, we find better outcomes if we treat longer than one life cycle of your red blood cells. And it may have to do with the fact that we're trying to prevent your new red blood cells from getting seeded or planted with old Babesia. And we need to do that we need to kill off the existing group, and then your new ones, as they're being born, are being bathed in your Malarone or your tafenoquine, and hopefully they don't get reseeded or replanted with Babesia, okay? So 2 things. By 3 months, you should have started seeing some improvements. And if not, then it's reasonable to think maybe I need to make some adjustments. by 2 to 3 months, actually. And number two, yes, 3 months is too short of a treatment. But yes, okay. Then finally, when we look at tafenoquine-based treatments, they're called tafenoquine-based. It does not mean that tafenoquine, although tafenoquine is a very good drug these days at treating Babesia and killing Babesia, most treatments that are tafenoquine only will not work. That is not how I would have designed a Babesia treatment. I would have designed a Babesia treatment that used tafenoquine. In addition, after somebody was stable on it, then I would have added either atovaquone, which is mepron, or malarone, which is atovaquone plus proquinol. I would have added one of those in. And once somebody was stable on that, I might have added either cryptolepis, artemisinin, or azithromycin. And in people that are really having a tough time getting over this, I might even build a treatment that is tafenoquine, atovaquone, whether it's malarone atovaquone or pure atovaquone, as in mepron, cryptolepis, 5 milliliters 3 times a day, artemisinin, pulsing like I mentioned earlier, and azithromycin. There are times you got to do that, okay? So 2 things. I don't think it was long enough. I don't think you were seeing improvements, probably because it was used as tafenoquine alone. And that's not how I would do it in my practice. Okay. All right. Good luck to you, Rick. Hello, Lori. Let's see. I'll be doing another attempt at Lyme detox in March. I've had issues with herx and lots of fatigue. Any recommendations for herx? All right. So hold on here a minute. All right. So let's see. I'll be doing another attempt at Lyme detox in March. I've had issues with herx and lots of fatigue. Any recommendations for herx? Okay, so I want to explain about herx to make sure that you and I are saying the same thing. All right. So not all worsenings are technically a herx. Let me try to say what I mean by that. All right. So, and to do that, I need to go back. So I'm going to talk about something called cytokines. I mentioned them earlier tonight, but let me have my cytokine conversation with you. Okay. So whenever your white blood cells see a toxin in you, or yeast in your intestines, or Bartonella borrelii in you, or COVID in you, the white blood cells will respond to get rid of them. And some of the white blood cells will manufacture these chemicals called cytokines. And if the immune system isn't doing a good job dealing with those and getting rid of them, the immune system will keep trying harder and harder, and eventually it may make too many cytokines. Too many cytokines can give you headaches, give you fatigue, give you body pain, make your sleep difficult, etc. So all these symptoms that we call Lyme disease symptoms, a central part of them or central cause of them is excess cytokines. So really excess cytokine symptom, okay? Now, when you start killing germs and you get worse, that's because the immune system sees the dead bug parts and manufactures more cytokines, okay? So a herx is a cytokine surge due to killing of germs, all right? And you can get that killing either by starting antibiotics or increasing the dose of the antibiotics, or maybe heating yourself up while you're on antibiotics, and that heat dilates your blood vessels and sends the antibiotics further down your bloodstream, exposed and hitting germs that haven't been hit before. Okay, those are the things that might bring on a herx, all right? But a herx always is related to killing germs and getting more killing of the germs. A herx is not going to occur if you're on an antibiotic regimen you've been on for a while and you suddenly get worse. That's probably not a herx. That just may be fluctuation of cytokines that can occur, okay? All right, now, when you detox, when you pull toxins out, however you detox, whether you're sweating, whether you're using binders for your mold toxins, whether you're using a lot of glutathione to promote the liver detoxing. Whenever you detox, that movement in and out of you of toxins triggers a cytokine surge, which could make you feel worse, but technically it's not a herx. Okay, I just want to be clear about that. So if what you're describing in your question to me is when you detox, you feel worse, what I would say is that's due to a cytokine surge. It's not a true herx. Okay, I just want to be clear about that. But also, if you're saying every time you start a new antibiotic, you feel worse and you have a herx, then you want to do something about that too. So what you want to do to either limit cytokine surges due to detox or cytokine surges from killing germs, and we call that a herx, is limit their production. That's one part. Okay, so step one is use liposomal curcumin. I mentioned earlier the product I like is the Thorne curcumin phytosome product, and you would do 500 milligrams 3 times a day. That works by getting inside your white blood cells and blocks the factory production, your white blood cell factory production of cytokines. Okay, that's how that works. All right. Then the second thing you want to do is limit the messages that tell the white blood cells to make cytokines. And what the messengers are that tell white blood cells to make cytokines are oxidation agents. So when your immune system is trying to get rid of germs, one of the things it makes is hydrogen peroxide and spits it out on them. That's an oxidizing agent, okay? And those oxidizing agents can trigger your white blood cells to make more cytokines. So you want to limit the signal that is telling them to make more cytokines. And to do that, I like using glutathione, which is also a detox agent in your liver, but it's also a very powerful antioxidant that can help limit these signals that tell your white blood cells to make cytokines. And so if I'm doing it in somebody that can be very sensitive, I might start at half a teaspoon 1 time a day of the tri-fortified liposomal glutathione product that is made by Research Nutritionals. But if I have somebody that's not really sensitive, I might actually start at a teaspoon a day. Why do I use that product as my glutathione product? Well, because it's absorbed. And there's a lot of liposomal or glutathione products out there and non-liposomal glutathione products out there that basically just don't get absorbed. Research Nutritionals has done a study that looked at how well absorbed their product is. And in their study, they showed marked increases in glutathione levels within red blood cells in the body. I think it was like about a 35 or 40% increase. It was pretty astronomical. It was a pretty good amount, okay? So they've documented it. And I see in the real world, when I use it in my practice, I see benefits from it too, all right? So my cytokine reduction protocol in herx reactions or in people that are having a hard time handling detox is curcumin phytosome by Thorne, 500 milligrams 3 times a day. And I like to couple that with Trifortify liposomal glutathione by Research Nutritionals. And I like to have people take a teaspoonful 1 time a day of that, unless they're really sensitive, and I might just do a half teaspoonful. Okay? All right. There you go. That's what I do. Good luck to you. So let me just do a quick screen share here. Oops, I guess that didn't work. Let's try that again. It'd help if I didn't hit the cancel button. All right. So when you go over here to the recommended supplements that I suggest people take, you can look under this cytokine and Herxheimer reaction tab. And here is where you're going to find, there's that Thorne curcumin phytosome I was mentioning. And here are the various Trifortify products, okay? And again, you can find all of these when you go here. It says buy at Marty Ross MD Femologist store. Again, I no longer sell the products directly myself, but Femologist is the company I'm using to sell my products. They're my trusted partner. So feel free to buy them through there when you get over there. Okay. All right. Hello, Joyce. Let's see. I've been to many over the years, and other than the one who passed away, none have helped. At this time, I'm taking cryptolepis, Japanese knotweed. Sorry, Joyce, I don't know where the rest of your question is here. I think I may have canceled it earlier, unfortunately. Excuse me a minute here. Hello, Joan. Let's see. I'm tolerating the itraconazole and the other supplements you recommended well. I plan to repeat the urine mycotoxin test when I am finished my 6-month protocol. Question is the cholestyramine important to take? Can I take herbal binders instead of it? GI Detox Plus is not available here in Ireland. Ultra Binder is available. If yes, how should I incorporate it considering my diet and supplements? Question, would the itraconazole treat any mycotoxin? Excuse me, everyone. Would the itraconazole treat any mycotoxin in the sinuses? Is a nasal spray really necessary? They are not available in Ireland. Question, can mycotoxins cause foul-smelling stools or strong-smelling urine? That is normal on urinalysis and being well hydrated. Dr. Ross, thanks for all you do. I would appreciate any insight on the above. All right. So regarding your urine smell, that has many different things. It could be from some of the products you take. It could be from the food you take. It's hard for me to say where that's coming from. Okay. I do in my practice work with herbal binders as substitute or supplement binders as substitute for cholestyramine. If you're going to do that, and I don't know this product you're talking about called Ultra Binder, but you want to look for a product that has a number of things in it, including clay or zeolite clay, one of the clays. Charcoal would be another one that would be in there. Humic acid, fulvic acid are also help make it a broad spectrum binder, and silica. So if you can find a product, or you could look at a GI Detox Plus and see what's in there and try to mimic it on what you are on through another binder, like an Ultra Binder, okay? So yeah, you could do that instead of the cholestyramine. I do that with my patients here in the States all the time. Regarding itraconazole, so itraconazole and mycotoxins, the itraconazole does not actually treat mycotoxins technically, but what it does do is some people that have mycotoxin illness are actually may have a problem where not only were they exposed in their environment before and breathed in the mold toxins that got trapped in them, but there are some people that actually may be colonized with mold spores in their sinuses, and those mold spores start producing the toxins, all right? Now, we don't have good testing for that. And in my practice, generally what I'll do is I'll try binders first for about 6 to 9 months. But if I find we're not getting rid of mold toxin levels, and if I am sure that the person's house is not exposing them to more mold toxins, then I start wondering, could it be from colonization? And it's about 6 to 9 months into my regimens that I'll begin itraconazole. Now, I know there are some of my partners, practice, or colleagues, I should say, out there that like to put everyone right away on mold toxicity, right on itraconazole. I find you only need to do that about 20% of the time. And I don't like to do it. I don't like to add another toxin into a person unless there's a proven reason to do that, okay? So I'm not a person that will start somebody on itraconazole right away. But if somebody's not getting better by 6 to 9 months after using binders, then I would. Ideally, you would want to use an antifungal spray for up here and also be on itraconazole. Itraconazole will get at intestines in case you're colonized there, and will also work its way into your deeper sinuses through the bloodstream. But we find the combination of itraconazole and a spray up in your nose to probably be more effective together, okay? Could the itraconazole be effective on its own at the sinus passages if they're colonized? Yeah, it could. I just think we get better results if we're doing the sprays as well too, okay? All right. And then I think I just answered your question. I think I got through all those. All right. Good luck to you, Joe. Hello, Rick. Let's see. Can you talk about blastocystis hominis? My wife tested positive on GI map. How would you normally treat it, if at all? So so blastocystis is a parasite that is controversial, is what I'll say. Um, Blastocystis exists in healthy people and it exists in healthy intestines. So even though it's a parasite, just finding it there does not mean it's causing a problem. And it has been my practice to not do anything about it. All right. Because as I look at the data on this and the science on it, it is a common organism that lives in some of us, and it's not a harmful organism. Okay. All right. There you go. Good luck to you. Good luck to your wife, Rick. Hello, Lisa. Let's see. Hi, Dr. Ross. Question about artemisinin for Babesia, sick 25 years, finally diagnosed with Lyme 3Bs 2023, severe herxing, but finally starting to tolerate some herbs. But when I add small doses of artemisia or artemisinin, I can't tolerate it. Dizziness, vertigo, balance issues, tinnitus, chemical smell in the nose, chest burning, memory loss within 2 days. It subsides within 24 hours of stopping the artemisinin. I've tried 3 times with 3 brands over a span of 1 year, but it's the same response each time. I'm concerned this may be neuro side effects of the medicine, not necessarily herxing, for 2 months. So far, I've been tolerating Houtanias, Teasel, Smilax, Coptis, Cordyceps, Chinese skullcap, and don't want to take any pharmaceuticals unless absolutely necessary. Are some people just intolerant of artemisinin? Are there other effective herbal Babesia options I can add while treating all 3 Bs? Thanks, Lisa. Yeah. So yeah, I think you're having a side effect. I don't think that sounds like a typical what I would call herx reaction. The artemisinin in terms of herxes it would cause would be from a Babesia. And again, a typical Babesia herx is going to be probably lower energy, maybe some air hunger. Those are the typical things that I'll see, maybe some more headaches. Those are typical what I see with the Babesia herx. I think you've got an artemisinin side effect in you. It's an artemisinin side effect. So I don't think there's a way to do the artemisinin. The herbal antibiotic that I would look at doing is the Cryptolepis that I mentioned earlier. Cryptolepis is useful also at treating growing and hibernator persister Borrelia, growing and hibernating persister Bartonella, so both Borrelia and Bartonella. And in addition, it's the strongest herb we have against Babesia. In fact, I think it's one of the stronger herbs we have against Bartonella and Borrelia as well too. When I'm using it to treat Babesia, I'll start at a half teaspoonful 3 times a day. And as it's tolerated, I try to get my adult patients up to a teaspoonful 3 times a day. I often will try to couple that with artemisinin, but obviously that's not an option here for you, okay? Another thing you could consider combining it with is Alcornia and Sida acuta. You can find some companies that make a Cryptolepis, Sida acuta, Alcornia tincture, and that's called CSA, or you could get these as independent herbs. The Sida acuta also has activity against Bartonella as well too. So you could do a Cryptolepis, Sida acuta. You could get Sida acuta as a standalone tincture, do 30 drops twice a day, your cryptolepis as a standalone tincture at a teaspoon, 5 milliliters, 3 times a day. And you could get alcornia, and I would do that also as a 30 drops 3 times a day. Okay. If you were to do that, you could probably eliminate the hootonea and the teasel. The hootonea is what would target Bartonella, but crypto can target it. Okay. And the teasel is targeting Borrelia, but crypto would target that too. The Sida acuta would also help with Bartonella too, under this regimen that I just mentioned. Okay, so if you were to do that, a cryptolepis tincture, an alcornia tincture, a Sida acuta tincture, you could pull out the hootonea and the teasel. Okay, all right. Good luck. Hi, Galena. Let's see. What is your opinion using ivermectin for Lyme? So I've looked at the science on this. I just want you to know. And when we look at the science, there is no science that justifies that it kills Borrelia. Just don't see it. There is science that shows it may kill Babesia, but I wouldn't call it the strongest killer of it. And there is no science that says it kills Bartonella. Having said that, there's also not a mechanistic reason to believe it would kill Bartonella or Borrelia, okay? So generally, I don't think it's useful. However, having said that, ivermectin is also a good regulator of cytokines. It's an immune regulator. And so I know of clients that have come to see me that were started on ivermectin by other providers who don't understand that there's no science that says it kills anything and there's no reason to believe it would. All right. They still put them on ivermectin because there's a viewpoint out there that the glory killer of anything is ivermectin these days. It's like, you got an illness, here, take ivermectin. We seem to be doing that these days. But let me put my commentary aside. The reason I think that people may feel better on ivermectin has nothing to do with killing. It's that it regulates inflammation, it regulates cytokines. So I have to admit some people do feel better on it, but it is not, I don't find it useful at moving, killing, or treatments along other than giving some control on the cytokines. That's it. Okay? All right. Good luck to you. Hello, Barb. Let's see. I've tested positive for the 3Bs, candida, overgrowth, dysbiosis, malabsorption, long COVID. I also have low ferritin, around 20. I'm being by supplement iron. How do you balance the potential benefits of iron supplementation, risk of feeding infection or causing other negatives? Oh, so, we want to keep ferritin, so an ideal ferritin level that gives, so ferritin, everyone, is the storage form of iron in the body. And iron is needed for a number of reasons. You need it for your red blood cells, to make red blood cells. To hold on to oxygen in your red blood cells, I should say. We need it. We need it for various chemical reactions that give us energy in the body as well too. And you need a certain amount of it to keep you from having hair loss. Okay, all right. And what that ideal number seems to be is 40 or a bit higher, like maybe 40 to 50 or 40 to 60. If you start getting above ranges of that, it might become pro-inflammatory. Most recommended doses that you're going to find in iron supplements are not of a sufficient amount to put your ferritin over 60 or more. So if you're concerned about it, I would start an iron supplement, whichever one it is that you want to try it. And in about a month to 2 months, go back and retest your ferritins and try to find a dose that you would take that don't put you much over 60, basically. Okay. But try to get it up to at least 40. All right. Good luck to you, Barb. All right, everyone. That's it for me for tonight. So normally at the end of the month, I would take a break before starting up the next month, but we're going to continue on. The current set of webinars we've had scheduled were just through the end of January. So tomorrow morning, I will release the next series of webinars, which is going to be for February. And at this point, I'm planning on doing 4 in a row. So you're gonna get to see me 4 more weeks in a row in February. And so tomorrow morning, when I send out the email announcing that the recording has been the summary has been created, and the recording is ready to watch, I will also include an email sign up for the February series of Conversations with Marty Ross MD. I look forward to seeing you all there, and I hope you'll join me. And thank you for being here tonight. Yeah, I think that's it for tonight. So, the other thing is, so I did mention this earlier. If you're wanting more individualized help, I'd be glad to help you. Just sign up for one of my consults or full service medical visits at martyrossmd.com. All right. Good night, everyone.